Hello, my name is Brandy Fontaine and my topic is error prevention and patient identification. According to professional sites APR.org, patient identification is the practice of having a patient identify themselves by using two patient identifiers, which is essential in improving the reliability of the patient identification process. The use of two identifiers also helps to ensure that a correct match is made between the service or treatment and the individual. Patient identification and matching of a patient to an intended treatment is an essential activity that is performed in all healthcare facilities and overall helps to minimize the risk of errors and helpfully to prevent them from happening altogether. Many safety hazards can derive from not properly identifying a patient, but some of the most significant ones are incidents such as medication errors, which could potentially be detrimental to a patient's health status. Another safety hazard that could occur if a patient is not properly identified is the nurse could not practice the proper safety precautions. For example, if a patient is on specific precautions such as airborne or contact and the nurse does not have the correct patient, then the proper PPE will not be used, which could result in a major break in infection control for staff as well as the other patients in the facility. Two strategies that the East Longmeadow Skilled Nursing Center implement to ensure error prevention and proper patient identification include using the 3 checks before administering medications. This helps to make sure that no medication error occurs and promotes safe medication administration in the healthcare facility. Another strategy that they use is placing patients' photos on the inside of their charts, as well as the patient's name and bed number on the outside of the patient's room. This helps in making sure the nurse has the correct patient and allows the nurse to verify the residents in more ways than one. Some technology and information systems that the East Longmeadow Skilled Nursing Center uses is a universal program called MassMap. This program is extremely beneficial if any type of catastrophe were to occur that would cause the patients to have to evacuate the facility and be placed at a different location. MassMap helps to regenerate patients' files, locate where the patients have been relocated to, and make sure that the correct charts get placed with the proper patients. This is extremely helpful in promoting patient identification and error prevention. The facility also uses paper charts, MARs, and large dry erase boards are placed at each nurse's station that include all of the patients' names as well as their room numbers. One strategy that I would suggest would be to have the patients wear scannable bracelets as a form of identification. Although they have many methods in place to make sure identification is properly done, there is still room for error and there is always a risk of improper patient identification. I feel that using scannable bracelets could lower the risk of medication error. The regulatory agency that our facility uses as a SAFE model to guide their own safety strategies, according to their website, is the Joint Commission. According to the Joint Commission website, one of their main goals, which became effective January 1st of 2017, is to improve the accuracy of patient identification by using at least 2 patient identifiers when providing patient care. The East Longmeadow Skilled Nursing Home was accredited with a gold seal of approval by the Joint Commission on their annual survey for focusing on quality care and remaining deficiency-free. The East Longmeadow Skilled Nursing Home follows a procedure from the Berkshire Healthcare Systems that proper identification of a resident must be done by applying an identification band around either the wrist or the ankle of the resident upon admission. This identification band must be checked when administering medications. If a resident refuses to wear a band, a request will be made to photograph the resident for identification purposes. A copy of the resident's photograph will be placed in medication administration records and the clinical record. This is how this facility monitors these safety strategies are being implemented. Although the residents at this facility do not have identification bands, they do follow this procedure by implementing the placement of a photo inside of the patient's chart, which was shown to me by the charge nurse on the long-term care unit. I feel as though the strategies that are implemented at my clinical facility are very effective in preventing errors from occurring, as well as making sure that proper patient identification is done. The staff has demonstrated to be very cautious in the way that they work, and they continuously practice multiple different safety strategies to assure patient safety as well as the safety for themselves. Thank you.